Rachel here. I'm so glad you are watching this video. This is my new vlog on Your Birth Site, and I'm a doula. I'm a certified childbirth educator through Lamaze International, and I'm super excited to be bringing you short little snippets of information that I hope you find helpful and beneficial. Today's topic is early pregnancy symptoms that might be concerning. So the first one is spotting, and if you're having spotting, if it's heavy, if it's bright red, definitely be in touch with your provider. What's normal and usually a sign that everything's okay is maybe a little bit of spotting, either brown or like kind of light pink or bright red, but very light in volume. That can be a sign of implementation or just your body adjusting to the pregnancy. So it is a degree of normal. Like I said, if it's heavy flow, and with maybe accompanied with a lot of cramping, then this could be sign of miscarriage and you would want to consult with your care provider. Miscarriage is very common, but also so is bleeding and then carrying on a healthy pregnancy. So just wanted to give you some information about that. I've experienced my own miscarriage, and I had no bleeding with that miscarriage. It's called a missed miscarriage. If you have questions about miscarriage, please let me know. You can reach out to me directly, and I'd be happy to kind of walk you through that or answer any questions specifically related to that. The next common pregnancy symptom is cramping. So cramping occurs because the uterus is now expanding. There's a lot of new things happening inside your uterus, and so as your uterus expands even a little bit, that's going to feel uncomfortable. You're going to have cramping. I would say severe menstrual cramps associated with bleeding, again, would be more like miscarriage, but just cramping, bloated, tightness, just general like kind of down there. That's normal. That is a sign your body is growing and expanding and making room for your new baby. Some questions about when you might feel the baby move. That happens much later in pregnancy, usually around 23 weeks or so, especially for first-time pregnancies. If this is not your first pregnancy, you might feel the baby much earlier, maybe 13, 14, 15 weeks. So just know that if this is early pregnancy for you, it will be a while before you actually feel your baby move. And some of those early movements feel like butterflies in your belly, little flutters. And when you identify it and notice it, it's really pretty amazing. And then those little butterflies will grow into big movements and cakes before you know it. Oops, my slideshow went away. There we go. The other question and worry that many first-time moms have is about hearing the heartbeat. And a lot of times if you find out you're pregnant and it's early on, you might want to rush to the doctor, but they probably won't see you until about 9 or 10 weeks. And that's usually because that's a great time to get a picture of the baby and hear the heartbeat. You can hear the heartbeat as early as maybe 7 weeks. But again, it's not guaranteed. So if you go in too early and you can't hear the heart, you might be really worried that something's wrong, and nothing's wrong. You just need to wait a little bit longer. So when you go to make that first appointment with your midwife or your doctor, just know that first appointment may not happen until 9 or 10 weeks. And that's usually when you can definitely hear the heartbeat. So I go over all this in my first trimester pregnancy guide, and so much more. It's like 30 plus pages of all about the first trimester, symptoms, remedies, what to expect at the first appointment, how to, move your body, be active, what to eat, mindset, so working on fear and preparing for the rest of the pregnancy. And you can get that for free over on my website, which is right here, yourbirthsite.com, and go grab your copy today. Also, I am super active on Instagram, and I would love if you came over there and joined me and, got in on the conversation over there. So you can follow me at yourbirthsite_Rach. I look forward to connecting with you guys soon. Bye.